happy, be healthy, be your best. Be your best.
So this episode, we're going to talk about the urinary system. And, you might just not think that much about it. It's kind of like when you got to go, right? Or there's a classic example that you think that you've gone enough and then you go camping and you climb in the sleeping bag. And as soon as you put the dang zipper up, what do you got to do? You got to go out of the tent and pee, right? It's just the way it works. Well, you're going to be surprised at how much the urinary system actually ties in with other organs, glands, and systems in the body. There's a lot of organs, glands, and systems that are connected with it and that really have a profound impact on it. But at the same time, it has a big impact on the rest of the organs, glands, and systems. Here's some of the ones that are involved with the urinary system: cardiovascular, endocrine, nervous, lymphatic, skeletal, digestive, and respiratory. Now, you kind of surprised at that list? Did you know that many organs, glands, or systems were involved with the urinary system and vice versa? Well, let's dive in a little bit deeper. Cardiovascular. So cardiovascular, the connection with the urinary system is the kidneys filter the blood, and they help regulate blood pressure by working with the adrenals, the lungs, and the liver. There's also an impact on blood volume and also what particulates are in the bloodstream. And a lot of this influences the movement of water across the cell membranes, which is what helps the cells to function. This is really, really important. So in the office, we always, when we scan people, we look at the heart. Those lines that you're seeing connect with boxes that show us if there's somewhere between 1 and 9, how the heart is functioning on a frequency level. And we're able to look at those numbers, and then it reports to see if there is a connection between the cardiovascular and the urinary system. How about the endocrine system? The kidneys stimulate red blood cell production in the bone marrow. And there's a really tight relationship with the adrenals and the pituitary for diuretic properties, and also aldosterone levels for water absorption and sodium levels. The adrenals sit on top of the kidneys, and they help regulate the salt-water balance in your body. And this is crucial because the body really needs to use the water and the sodium efficiently for so many functions in the body. So here you see a picture. This is what we look at when we test people. We check to see the tight relationship between those adrenals that sit on top of the kidneys, and then also how it ties in with the rest of the body, pituitary, and the other systems that we're talking about. So we look in particular at the adrenals when we test someone. And you'll see in the bottom on the right-hand side, aldosterone. That's where we get to look. This person, their numbers are fine, but other times there's a 1 or a 9 there. When there's a 1 or a 9 there, we know that area is either really tired or has frequencies for inflammation. And then we can look and see, how's their water-salt balance in their body? How's that affecting the heart? How's that affecting a lot of other processes in the body? Do they need electrolytes? Are they drinking enough water? How's their diet? There's all kinds of things that tie in simply by looking at the adrenals. How about the nervous system? There are signals between the nervous system and the bladder that allow urination. There's a really tight relationship with the muscles of the bladder and the urethra and the nervous system to allow things to constrict or relax in order to have urination work correctly. So here again, we look at the spine, and then we also look at all the other views of the nervous system to see what kind of relationship there is between that nervous system and the kidneys, the bladder, and everything else with the urinary system. How about lymphatics? The urinary system affects the amount of lymph fluid in the body and the fluid surrounding the cells by influencing the solids and the water in the body. And so when you consider the function of the lymphatics, where the lymphatics have to transport nutrients and take away waste, well, then think about what the kidneys do. They filter the blood to help get rid of the waste through urination. So you can start to see that the two have to work together like really good partners in order to have an efficient urinary system. Here again, there's a lot of lymphatics in the body, and we just check all of them to make sure that people are not having different particular problems with the lymphatic system that are causing complication with the urinary system. Skeletal. So the urinary system, especially the kidneys, they regulate things like calcium and phosphate levels in the blood, and that really impacts bone health and muscle function. Also, vitamin D, which is crucial to the immune system, it relies on the kidneys to be activated. And this also relates to bone health as far as calcium absorption. So you start to see how those kidneys are playing in a lot, even with things like bone strength. And how many people do you see anymore that are suffering from osteopenia, osteoporosis, all kinds of problems that could be directly related to just looking into how is their urinary system working, and is there a connection with causes of problems with the skeletal system? Think about the fact that the kidneys can affect every single bone that's in the body, and you start to appreciate the relationship between the two. How about the gut? The gut affects everything, and the urinary system depends on the nutrients from digestion in order to work properly. And the gut, in particular in the large intestine, there's a lot of absorption of the water, and the electrolytes get used. And the kidney depends on those in order to do what it needs to do, in order to balance things out. So we always look at the gut to see how it's functioning, because it's going to impact the kidneys, and the kidneys are going to impact the gut. So here again, everything is just connected so tightly that we need to look at the body as a whole and then figure in the function of the urinary system. Respiratory, the urinary system helps regulate the acid-base intricate balance in the body. This is important because that acid-base balance has a lot to do with the respiratory system ability to regulate carbon dioxide levels in the body. When those carbon dioxide levels get off, the body can get very, very acidic, and that can lead to different diseases and different problems within all the systems. So we always look at the lungs and sometimes a close-up of the lung lobes to see if we can track down any connection between respiratory and urinary. So we really take a close look through an inner voice program that records the voice and tells us what tones are off in the emotions because it picks it up off the vagus nerve. And the reason we do that is the kidneys are usually affected by fear, and the bladder is a lot of times affected by paralyzed will, feeling stuck. But there's tons of other emotions that also can affect the kidneys and the bladder. One of the phrases you hear all the time is when people say they're so pissed off. Why would they say that? Well, pissed off? Sorry, that's urine. There is a direct relationship between frustration and a lot of those emotions and how the kidneys function and what happens with the bladder and urination. So we have a lot of tools that we use to help people in relation to the urinary system. But for you starters at home, you want to keep a close eye on your hydration. If you're drinking a lot of water, you're just drinking and drinking and drinking, it seems like it's just going through you like a hose, then the adrenals are needing assistance with those aldosterone levels. You might need to have some electrolytes. You might not be getting enough sodium. The government says, less than 2 to 3 grams. Worldwide, it is shown that the countries with the least heart attacks, the least strokes, the best blood pressure, do 4 to 6 grams of sodium a day. More on that in another podcast. But these are the things that you want to start looking at home. And make sure that if you're hydrating, that your water is clean water. Water that's going to be good, that's not going to put an extra load on your kidneys as far as filtering. So, hydration. We're in summer. In summer, there's increase of exercise. There's evaporation through sweating. There's a lot hotter temperatures. It's really, really important to be kind to your kidneys and your whole urinary system by paying attention to your hydration. There's one company that we recommend for electrolytes, and that's LMNT. You go to the link below, You can look at all their research. And if you use that link with your order, they send you a free sampler pack of all of their flavors. And that is a really, really useful tool because they have the proper sodium, magnesium, potassium ratio that is so vital for the body having proper hydration, which then aids the whole urinary system. So I hope this has helped you understand the urinary system a little bit better, how tightly it ties in with so many other functions in your body. And we will talk more about some of these subjects in future podcast episodes.